Okay, folks, I'm super excited to have my longtime friend here, Dr. Sanjay Iyer. So Sanjay, awesome to have you here. Would love for you to maybe start by telling everybody, give us a little bit of background, like where do you live, what do you do currently, and quick highlight of your entire kind of career arc.
Sure. Well, Alex, first of all, thanks for having me. It's an honor to be here and speak with you and share my story with all of these physician leaders. So I live in Savannah, Georgia. I'm an emergency medicine physician, originally from the Washington, D.C. area, right near you, Alex. Did a combined BSMD degree for undergrad and then went to medical school at UPenn in Philadelphia, where I really committed myself to a career in emergency medicine. Did my residency training at Carolinas Medical Center in Charlotte. And then after that, basically took my first job out of residency here in Savannah, Georgia. Took a leap of faith, didn't know anybody here, actually. My wife and I just fell in love with the city. I wanted to be on the coast. And let's see, 14 years later, we're still here, had all of our 3 children here. And so, yeah, I'm still a practicing emergency physician here in Savannah, Georgia, 14 years into my first job.
That is amazing. And you have a leadership role with Sound, right?
Yeah, so great point. So when I first started here, we were a private Democratic group. Approximately 3 years ago, we were acquired by Sound Physicians, and I've had a national leadership role with them since then. Currently serving as the National Medical Director of Practice Performance. Prior to that, I was the Director of Clinical Documentation Improvement. And prior to that was Vice Chair of the Emergency Department at my hospital.
Amazing. So what was the first like non-clinical / kind of admin role that you ever had?
Yeah, great question. Actually, believe it or not, my whole kind of trajectory started a little bit in residency when I developed an interest in clinical informatics and documentation, always trying to find different ways to be creative, save time for the clinician, but at the same time, not necessarily maximize, but make sure that we're appropriately generating the worth that we're providing to our patients, by documenting appropriately, but in an efficient manner. So I actually became a Cerner super user in residency and helped implement Cerner at multiple sites in our residency spectrum, which at the time was called Carolinas Medical Center. Now it's called Atrium Health. So I developed this interest and passion for clinical informatics and documentation then when I came into my first job as an attending, I continued on that passion by building all the dot phrases and, for Epic and trying to help my colleagues document in a more efficient manner. But I'm sort of a tech geek in a way that I enjoyed diving into the EMR and sort of finding ways to optimize it. And so that naturally kind of led to my role as Director of Clinical Documentation Improvement, which combined my passion for documentation and optimizing efficiency with also understanding the business side, right? Which is what so many emergency clinicians so many physicians in general aren't aware of, the business ramifications, the reimbursement, the rev cycle ramifications of what we document and why it matters. So I was able to combine those two things. So it kind of started in residency, but then definitely propelled itself forward throughout my attending career.
So like when you were helping out with creating these dot phrases, for example, is that something you just volunteered for, or was somebody paying you for that, or what?
Yeah, no, I totally just did it myself. No, never got paid for that. To be completely honest, Alex, I did it for me to help me be better, right? So I don't forget things that I want to make sure I include. Like when I'm doing a headache workup, I want to make sure I talk about the fact that I considered meningitis. Of course I did. Subarachnoid hemorrhage. Of course I did. But if I don't have it built in, I might forget, right? And so I created for me, and then I started sharing it with 1 or 2 docs, and then they shared it with 1 or 2 docs. And next thing you know, 25 doctors in the group are using these dot phrases, and they can manipulate them to their own liking, of course. But so I did that just out of my own, interest and need.
So then did that spark like admin to see like your skills, and did they create that role for you that you then subsequently took on, or did that role already exist, or what?
That role was created when I joined Sound because of my interest in it, but also the company had a need. They knew they had a need for a physician leader who could communicate with physicians because it's very different. And the whole point of this course, right, is to understand that physician leaders are unique because we bring the clinical context and background and training and reputation, but we also can combine it with the business side. So they had a need for it, and they were looking for someone who had a natural passion for it already and someone who could sort of create, right? Because a lot of what I do in my role and a lot of what physician leaders do is create, whether that's creating content or creating solutions. So that role was created right when I joined Sound, and I immediately raised my hand and put myself in the running for it. Of course, it was a national search, but so I applied for the position.
That's amazing. I always thought that clinical documentation improvement or optimization was like such an untapped opportunity in emergency medicine and probably in other specialties too. And my mentor in my career, Don Infeld, he used to always say that like documentation is an open book test. We know what's supposed to be written there, and yet we still don't do it. And then we submit it for payment, and then we're so upset when things don't work out the way we want. Like, it's so dumb if you don't have this sort of role being done by somebody and a process, right? So maybe tell us a little bit more about the work itself.
Yeah, absolutely. So the first thing was to create an understanding, a curriculum for doctors to understand what is required. Believe it or not, Alex, what I was surprised by was the number of new physician graduates from residency programs who aren't aware of what's required to document in the chart. So even simple things like how many elements of HPI, how many elements of review systems. And then we had a monumentous change in 2023 with the new CMS guidelines that completely changed what's required for the documentation requirements, right? So I had to create an entire curriculum for that. And, luckily what I enjoyed about that was I was able to take my clinical context, clinical background, physician leadership, but work with the technology team to create the material. So I didn't have to do all the actual necessarily slide creation, but I had to do content creation. Once you created the content, then you have to find a way to present that to the physician. So I created modules. They have to basically click through these modules, which every physician hates clicking through modules, including myself. I get it. But at the same time, I got a lot of thank you emails saying, hey, thanks for breaking this down for me in a way I could understand it. Because as you know, when you look at the MDM grid, it can be very overwhelming, especially with the new changes that took effect in 2023. So I myself had to take a lot of time, read, learn. I went to webinars and watched experts in billing and coding teach me how to do it. Then I can then teach others how to do it, So I didn't just naturally know the information. Nobody does. You have to study it and learn it and read the CMS documents and things.
I think if you look at a lot of physicians who have excelled in some sort of leadership role, especially something like what you did where it involves some sort of education for other physicians, one thing they have in common is the ability to take something really complex and synthesize it into something that's more easy to digest, right? Because as physicians, we're overloaded with so much information from so many different directions. So it sounds like you did that. So kudos. That's amazing.
My mantra in emergency medicine, Alex, has always been, and I can't take credit for this. One of my mentors in residency taught me, but KISS, keep it simple, stupid. So if you're like me and you're kind of a dummy, but you want to try to remember everything, just remember, keep it simple, right? So I teach these doctors, what do you need to do? Yes, you can do all these things,
right?
But what do you need to do? And if you just remember what you need to do, then you're much more likely to be successful and have a good result than if you're trying to do everything that's possible, and then you might actually forget what you need to do. So I keep it simple.
I love that. So if somebody listening is a new or young physician trying to figure out how to create value, right? I think one of the easiest things you could do, well, not easy, but it's available, is to take an existing, very complex, confusing process or guideline, and go super deep into it, know everything about it, and come up with your some simpler version of it, right? And go back and say, okay, I've simplified it into a one-pager. Here's what we really need to know and do, right? That's immediately generate value for all of your colleagues.
Yeah, definitely. That's a big part of what we do. Actually, take these big, broad concepts or changes or policies, like MIPS. MIPS can be very confusing to an emergency physician. But then when you break it down, it's like, these are the 9 elements that we want you to be aware of, that we're tracking, and that are important for patient care. And it's much simpler that way.
Yeah.
If you just look at the MIPS website, it can be overwhelming,
So tell me, a lot of times education is not enough when you're trying to change doctor behavior. Did you guys do things other than education? And what was your role in that, if so?
Yes, we did do things other than education. So, in addition to education, we also did very active monitoring. So we had to actually build tools using AI and machine learning to track acuity trends. And then there would be targeted interventions to those physicians and clinician APPs who were low performers or who were missing opportunities. For example, so we didn't just create the education and say, okay, good luck. Then I had to create tools where we can use machine learning to our advantage, track trends and opportunities, and then reach out to those individuals and say, hey, did you know that you're forgetting to bill critical care 50% of the time, or when it's appropriate, or you're forgetting to document your independent interpretation of imaging when it's appropriate? And they would say, oh my gosh, thanks for letting me know. You're right. You know why I forgot that? Because I didn't have a macro. I didn't have a dot phrase that was cueing me to these things. So
I think queuing, monitoring, and reporting back is so important in any sort of like change management. I remember in our group, we were trying to improve our patient satisfaction, and we had basically come up with like 4 or 5 things that every doctor could do in every encounter to improve their patient satisfaction. And it was like, hand out a business card, make eye contact with the patient and like shake their hand when you introduce themselves, sit down when you're taking the history, introduce yourself to all the family members, and then offer to bring like a blanket or pillow or something like that. There's like a 5-thing checklist. And so when we educated our doctors and said, okay, here's what you need to do, everybody's like, oh yeah, I do that all of the time, right? But then what we did was we assigned our scribes to actually score every single encounter for the doc for an entire shift, and then report that back out to them at the end. And not until a third party was monitoring you and giving you a report, did you realize you were only doing this maybe 30% of the time, even though you truly thought you were doing it like probably 90% of the time. Really amazing.
Absolutely.
And it has such a huge impact on physicians. I think physicians want to excel. They want to do better, but the system is just so overwhelming.
Yes, absolutely.
So Sanjay, then how did this role and like your leadership opportunities evolve over time?
Yeah, that's a great question, Alex, because to be honest with you, and I think I had a conversation with you many years ago when I accepted that first role, the one thing I would say, if there's one take-home message from my story is, and you've been a big part of me understanding this actually, is take the opportunity when it comes, take the chance. Because what's right in front of you may not be exactly what you're hoping for in terms of the role or the compensation. In my case, it certainly was not. But if you do a good job at that, it will be noticed, it will be impactful, and then other doors will open up because other leaders in your organization are watching you and they want to see what kind of impact you've had. So I'll give you an example. Just in my first year as director of clinical documentation improvement, I was able to help us reduce our lost charges from $1.8 million a year of lost charges due to documentation deficiencies to $64,000. So that saved the company, right? $1.75 million and more than that. And immediately they were like, oh, it looks like this guy's doing a good job at, reaching out to his physicians, developing rapport. And then naturally, especially if you have any entrepreneurial instincts or interest, you will meet and connect with other people in your company. And so then that opened up the door to do revenue cycle management. So then all of a sudden my role was increased, right? To not only do clinical documentation, but also to do rev cycle management. to also be the lead for our billing and coding partner. So all of a sudden you start taking on more responsibilities. And as you can imagine, with more responsibilities generally comes a promotion and possibly increased compensation. And then what started a couple years ago as maybe a small niche job that you weren't sure about ballooned into something more. And so that's exactly what I did. And that's how it happened for me. So, my advice is to take an opportunity when it arises. The other flip side of that is sometimes opportunity doesn't knock twice, right? And when you say no to something, it's okay to say no to something if you truly don't believe in it. And if it's not in your wheelhouse or your interest, absolutely. Don't do things that you have zero passion for, because there's low likelihood of success. But if you are passionate about something and an opportunity comes, and if you say no, sometimes that opportunity won't come back to you. And so, that's another lesson I have learned. I've had said no to something before, and in hindsight, I kind of said, I probably should have taken that opportunity when it came.
Yeah, amazing. So what are some of the things you love the most about your current roles, and what are some of the things that maybe you don't like as much?
Yeah, sure. No, good question. So I'm currently a national medical director, and what I love about that is I love being a physician, right? Number one. So I love being a doctor, and I have tremendous respect for my colleagues across the country. I know that EM physicians, and all physicians, frankly, but I'm specifically in emergency medicine. So EM physicians work extremely hard. They have a very tough job. I still work clinically, so I understand that. I know how difficult it is. I know how tiring it is to come home at 2 in the morning or 3 in the morning or 11 p.m. even, or to miss my daughter's soccer games and all the sacrifices we do. I can relate to them. So what I love about my job is that I use this platform, this opportunity to help my physicians, not to hurt them, not to cause more burden on them, but actually, how can I make things easier for you? So for example, Alex, we have a lot of doctors who are on a performance-based compensation model, right? In other words, they make what they document and bill. Well, if they don't know what to document and bill, there's a chance that their earnings are going to be less. So by providing them education, providing them opportunities to learn and improve their documentation, for example, they're grateful because they're, hey, thank you for teaching me this. I'm actually making more money doing the same work I was doing before because I was leaving money on the table. Aside from money, obviously, there's the quality of care, patient care, which is always number one priority. So to make sure that our doctors are documenting appropriately, it protects them medical legally as well, right? When you document your differentials and you document why you did things and didn't do things. So I love using my position and my platform to help my fellow colleagues succeed. And as a result of that, I think that it makes me feel really positive because, like you, after 10, 12 years of practicing clinical medicine, some people, not everybody, but some people want to do more, right? And they know they can do more. And so I reached that point, and that's exactly when I made this change into a little bit more admin. But I don't do it to abandon my physician colleagues. I actually do it to support them and lift them up. So I love that part of it. And I love the understanding of the business side of medicine, because that really, truly is not taught to us in medical school.
Right.
It's definitely not taught to us in residency. It's so important to understand why Medicare reimbursement matters, how coding and billing happens, how reimbursement happens. How do you win contracts at a local site level? How do you not win contracts? What's important to maintaining a contract? All these things that I really enjoy. If I had to pick some things that I necessarily don't love, is that nothing is as rewarding as taking care of a patient, right? Like for me, like as a doctor. So you do miss sometimes that. In fact, yesterday was Sunday. I went to work. I worked a 12-hour shift in the fast track. And I sort of enjoy that opportunity to go back and connect with humans on an intimate level, be a doctor. So like, I do enjoy that still. And when you work admin like me, you do work less clinically, which has its pros as well. But for me, I'd say the only con would be that some days grinding through spreadsheets or sending emails, it doesn't necessarily give you the same day-to-day satisfaction and fulfillment as taking care of a patient, and just hands-on and comforting them. It also, though, doesn't have the frustrations of working in a hospital and taking care of patients, right? There's a double-edged sword. Every doctor knows that. And so, but I would say that's the only downside for me, is after 4 or 5 days of just grinding at my desk or in emails, I do sort of miss the human interaction, the human connection.
Amazing. Well, let's switch gears a little bit. For those who don't know, you're also the founder, creator of EM Docs Jobs, the largest Facebook group for emergency medicine physicians looking for jobs. And then you have a couple similar groups in other specialties. So tell folks, like, how did you create this? When did you create it? What was the story behind it? And how has this thing grown into this amazing thing that it is today?
Yeah, sure. So, 6 years ago or so, my group was trying to recruit, and we're a small city, Savannah, Georgia. We don't have a ton of people like Chicago, Houston, New York, LA, DC. So I said, how can I try to spread the word about our opportunity without paying all this money to put it in these magazine like ASAP or Annals or whatever that people are going to throw away? How can we do this for free? Because we were a small group at the time. We didn't have infinite budget. So I created this little group called EM Docs Jobs. And I basically just started inviting EM colleagues of mine. Hey, join this group. And if you have a job, just post it. It's totally free. And let's just see what happens with it. And I had like I think you were my first member, actually. You were the first person. I think you're the first member other than me. So, I invited you, then probably you invited your group, your colleagues, and then they invited their colleagues. And, at first it was like 100, 200 people, a couple jobs here and there. And then we finally grew and grew and grew, got to 1,000. Then once you hit 1,000, the growth was like exponential, so it really took off in a logarithmic fashion. Currently, now the group has about 17,000 verified EM physician members. It's definitely the largest job forum for emergency doctors in the world. And what I love most about it is, again, just like my admin job, it helps my colleagues find great opportunities and great jobs, So every day there's 8 to 12,000 active users on the site. There's hundreds of jobs being posted on a weekly basis. And the number of stories and messages I've got, hey, thanks to your group, I was able to hire and fill up my group, or residents coming out, hey, thanks to your group, we can find good jobs and we can know what's out there. And Alex, the key differentiator, by the way, the only difference between my group and everything else that's out there is I focused on transparency. So to a fault, sometimes I have required people posting jobs to include compensation. Because as you know, as all the doctors who are watching this know, so many job ads say competitive compensation or excellent pay. What does that mean? What is the doctors want to see what they're going to earn? And so this group is still to this day requires every single job to post the compensation. It's built a culture of trust. It's built a culture of awareness and transparency, which was definitely lacking in our specialty. And I'm super proud to see how doctors are now networking amongst each other instead of having to rely on outside sources to fill their openings and to find openings. So that's the story.
Yeah, it's been an incredible journey for you building this out, and for me as kind of an outsider watching you build this over time. It's turned into an incredible community that is, I would say, 95 to 99% like incredibly positive value add. But I guess for the humor of the audience, I'd love to also get your perspective on the 1 or 2% of folks who seem to be angry and upset about everything and kind of making themselves their own worst enemy. Talk to us a little bit about that phenomenon.
Yeah, definitely. So I'm not a huge social media guy, but this is obviously on Facebook. It's a social media platform. And as anybody knows who's on Twitter or Facebook or Instagram, there are always going to be negative people, right? And that's just the world we live in. And negative people, I believe, get amplified when they can sit behind a keyboard and write whatever they want because they're not talking face to face, right? Most of the negative comments that come on the group, I doubt that those people would say that to somebody else face to face. And to me, that's very sad, right? Because I don't like physicians being mean to one another. We are on a team. Like, we've got to lift each other up. My whole life, my whole mantra is positivity and lifting other people up, not bringing them down, right? So there were definitely, Alex, a handful. I would say a pretty vocal minority of people that would constantly just want to troll people. this job sucks. That's terrible. This company sucks. And not constructive feedback like, hey,
Right.
that rate is low for the region. Have you considered increasing comp?
Right.
Just trashing you, just tearing you down. So eventually I did have to put a rule, Alex, where no warnings. Like if you're going to be obscene or cruel or mean or just trolling, you're going to not have a privilege of being in this group.
Yeah.
It doesn't mean you have to say every job is great. You can absolutely leave constructive criticism. In fact, I welcome that because that's what makes us better. But to just sit and troll and just rip people apart, and believe it or not, people even use profanity, Alex,
Wow.
in a professional network, right? So that's just not tolerated. But I will say that 98% of the doctors in the group are professional, respectful. They appreciate the purpose of the group. And even the people who do get constructive criticism will message me and say, hey, I'm glad I posted this on your group. I got so much constructive feedback. We've actually changed our comp model and changed our shift lengths because of the feedback. And I was able to hire as a result of that. So there is good that comes with constructive criticism. There's no good that comes with hate and evil and animosity. And so, but yeah, I have taken some flack for removing a few people. But after warning, after warning, after warning, I said, you know what? I don't have time to like babysit people, you know? And anyone who runs a social media platform, there are several doctors who run different platforms out there. They can relate to that. I mean, it's tiring dealing with keyboard warriors.
Yeah, absolutely. And I think ultimately, like what I come down to is kind of the concept that you were mentioning, which is, listen, you can either take an optimistic and positive view towards life, right? And that includes opportunities like to do some project or something at work, or you can take a totally cynical view at everything, right? So I remember like in my own career, certain projects would come up, just like you're like creating these dot phrases, and nobody was going to pay me to do it. It was just something that I was personally curious about, or I wanted to solve, or who knows, right? But I'm like, okay, I'll just try it. And sure, I'm not getting compensated today for it, but it gives me an opportunity to do something, right? To create something, to solve something. So you can either have that attitude, or you can have the opposite attitude that like, I'm not going to do anything unless it's perfect, unless somebody's going to pay me for it, or this or that. And I've never seen those sort of people really succeed to their full potential, right? And they seem perpetually unhappy. And I think they really need to look at themselves.
I agree 100%, Alex. What I was going to say as you were talking is there are a lot of doctors who are burned out right now. Understandably, medicine is tough and it's only getting tougher, right? The practice of medicine, right? But if there's something you don't like, or something you can't stand, or something that's burning you out or frustrating you, be the solution.
Yeah.
Be the solution. I was tired of getting ads that didn't tell me how much money I'm going to earn. So I changed it completely on its face. But you have to go out there. You have to put yourself out there. You have to try. It's going to spend some time uncompensated. By the way, this site has generated nothing in terms of dollars.
Right.
All volunteer for the goodwill of the specialty so far, and that's okay because I wanted to change something for my colleagues and make it better. And but I agree with you, Alex. Yeah, you can't just be miserable. You have to put yourself out there, take a chance, and be a leader and make the change you want to see.
Yeah, amazing. So Sanjay, any kind of final comments, recommendations, thoughts for those who are like earlier in their career and trying to figure out how to grow and develop?
Yeah, Alex, I think that the most important two things for me would be, learn, take time, invest in learning, whether that's a program like this or reading outside of, your work, but learn about things that interest you or that challenge you or that frustrate you. If it's coding and billing, documentation, reimbursement trends, political advocacy, whatever it may be, learn about it. And then the second thing would be, if you have an interest in changing things, being a leader, supporting your colleagues, then take that step, invest in yourself, invest in learning how to be a physician leader, and take the opportunity when it comes, because sometimes you have to go and earn the opportunity. It's not just going to be handed to you. And a lot of times, as we both have done, Alex, you have to take the opportunity that doesn't come initially with compensation, or at least not the compensation you want, but by showing your worth and proving your value, that can lead to opportunities and more. So invest in yourself, and change the things that you find frustrating. And I think in the end, not only do you help yourself, but you help your colleagues in your specialty.
Amazing. Thank you so much, Dr. Sanjay Iyer. Thank you.
My pleasure, Alex. Thanks for having me.